My name is Bianca Runauer. I am going to talk about imbalance in T helper 17 self and target therapy in an infant with Sam-like syndrome. Definition: the SAM syndrome, which is characterized by severe dermatitis, multiple allergies, and metabolic wasting. This syndrome is a congenital skin disease caused by a mutation in the genes encoding either desmohelin 1 or desmoplakin. T helper 17 cells are a type of cooperative T lymphocytes responsible for elimination certain pathogens, mainly fungi and mycobacteria, that cannot be eliminated with Th1 or Th2 cells response. Applications in medicine. Avilot treatment targeting T helper 17 cells, including biological drugs that are currently licensed for psoriasis therapy, such as ustekinumab and secukinumab. Ustekinumab was recently evaluated with encouraging results in two patients with DCP mutations, but we have obtained little cutaneous improvement in another patient with some syndromes which has DCG1 mutations.
Your study today of secukinumab, you showed that this is effective, the first drug shown to be effective in ankylosing spondylitis. Talk a bit about the pathway and how this drug works.
It's the first non-anti-TNF biological to be effective. Of course, TNF blockers are effective, but it's the first non-anti-TNF blocker that is effective. The pathway is well studied in experimental models. We know that IL-23 is the upstream cytokine driving cells to produce IL-17A, and IL-17A is a very potent pro-inflammatory cytokine, certainly in synergy with other cytokines such as TNF or IL-6 or IL-1. We have a number of lines of evidence that this pathway may be very important in this disease. It relies on genetics, where we have different genes that are associated with disease in this pathway, IL-23, IL-17. We have data from experimental models. When we overexpress these cytokines, the animals get spondyloarthritis-like disease. And we have data from patients where we look in the affected tissues that we see that this cytokine is upregulated. So that's the background for targeting this drug in this disease.
And one of the interesting things that you found is that the response is rather rapid.
The response is very rapid. We see significant improvement already from week 1 onwards for the primary and outcome parameter ASAS20, but also for other outcome parameters. So very quick response. I think that's clinically very relevant for the patients and for the doctors to see that the drug is working very quickly.
And also sustained responses as well.
Yes, so our primary endpoint was at week 16. I presented the data up to week 52, and we see that from week 16 onwards to week 52 is just a flat line. So the responders at week 16 completely maintain the response up to week 52.
And also good results coming out in psoriatic arthritis as well?
Yes, there were 2 other trials in psoriatic arthritis, which shows also very good results. ACR20 responses around 60%, so that's very good. And it's consistent with the idea that this cytokine IL-17 is not only playing a role in ankylosing spondylitis, but also other forms of spondyloarthritis, including psoriatic arthritis. Now, that's important because Here, of course, we classify patients for the clinical trial, but in clinical practice, many of our patients have an overlap between these different forms. So it's great to have a drug that is working for the different subtypes.
And so the next steps for this drug?
The next step, well, there are other phase 3 trials ongoing. And of course, I'm not the sponsor of this study, but it would be highly surprising that they would not go for registration of this drug for these indications.
Pros and cons. Pros. The improvement was evident 3 weeks after treatment initiation. At week 35, the patient shows a marked cutaneous improvement. Cons. The treatment does not always work for all patients. The treatment sometimes takes a long time to act.
This is an example of the important steps in psoriasis plaque formation. First, while it's unknown what originates it, dendritic cells in the body are activated. These dendritic cells then release interleukin 12 and interleukin 23. Interleukin 12 then goes on to activate Th1 cells, which in turn release TNF alpha and interferon gamma. IL-23 goes on to activate Th17 cells. These cells then release interleukin 17A, 17F, and interleukin 22. Together, these released cytokines cause keratinocyte hyperplasia, which leads to the plaque formation that you see here.
Issues apply in Ecuador. Between 9 and 15% of the patients are complicated by the presence of meconiums in amniotic fluid and histological 5 to 12% of those cases below SAMS. This figure was dropped in developed countries to percent between 1.6 to 3.9%. Conclusion: the major effect of secukinumab on our patients' quality of life supports interleukin-17 as a new target to treatment patients with serious skin disorders such as SAM syndrome. For more, our study proposed an